Cancer is scary. Nobody wants to talk about it. I mean, come on. Who wants to talk about cancer and death? But unfortunately in China, cancer is reality. And people will have to deal with it either sooner or later. Most likely sooner rather than later. According to the World Health Organization, China leads the world in new cases of liver, lung, gastrointestinal, and breast cancer. In fact, China leads the world in the rate of cancer growth. Economic growth has brought great prosperity to China, but it has also brought ailments we've seen in the West for the past 4 decades. We are Agada, and our mission is to find solutions to this health crisis. But why? Why us? What makes us special? Well, 3 of my grandparents died from cancer. My grandfather died of liver cancer. My maternal grandparents both died from cancer, from leukemia. And my father, just 2 months ago, was diagnosed with leukemia as well. My chances of getting cancer at this point, I would say pretty damn good. It looks like cancer might follow my family across 3 generations, from China to Taiwan to America, and now that Shanghai is my home, perhaps back to China. I'm here to look for a solution to a problem that I might have in the future. And how are we going to do this? By introducing the best cancer care available in the world to Chinese cancer patients. Agada, an online marketplace for international medical services, where patients from around the world can find the best healthcare available, no matter where they are. Did we validate this idea? Yeah, of course. We called hospitals in America, and we asked them, do you want Chinese patients? They said resoundingly, absolutely. Not just Chinese patients, but Chinese cancer patients. Because that's where we can provide most value. We also looked at websites in the United States and Great Britain. Websites that introduced overseas medical services that were affordable and quality to people living in those countries. In fact, we talked to people about our idea, and everyone loved it. The masses of Chinese needing healthcare, the available expertise in the West. They loved it. They loved the hype. We loved the hype. We were excited. So we proceeded to build a product. Lucas, our tech guy, in 4 short weeks, through agile development, set up a product, tons of features. We were proud of ourselves. We were capable, we were quick. But whoa, hold on a sec. Wait a minute. We realized that we made the classic mistake. We assumed we knew what the Chinese patient wanted. We developed a solution to that problem. We built it, we tested it to make sure it worked, and then we launched it. But unfortunately, we found after the fact that the numbers just weren't there to support the assumption. Rewind! In a big way. We had to go all the way back to the beginning. This is Chinaccelerator. We only had 90 days to come up with something for demo day. So, we looked at bringing Chinese patients to the USA. Great margins, way high touch, didn't want to go there. We looked at clinics already in China. Sure, they're doing okay, but they haven't figured out how to provide services to the greater population. Not a good model. We looked at US to China doctor-patient referrals. An interesting idea, but again, highly involved, not a model for us. Bringing US hospitals to China, interesting idea, but the regulatory environment is not going to allow that. We moved on. Bringing US doctors to China. It's been done before. American doctors don't want to stay. But we did find that the second opinion market, second opinion cancer consultation is a viable option. How do we know this? Our competitors are doing something similar already. US hospitals have second opinion consultation centers set up specifically for international patients. a prominent Chinese investor specializing in healthcare actually asked us to look at second opinion. Probably most importantly, though, is that a similar model in China already exists, where Chinese patients are already calling in to doctors in China remotely and paying for advice. And we also found there's a lack of information on the internet for Chinese patients to find international second opinion information. Our next steps, assembling a team in America, who actually is already working on their first second opinion patient. This person in China has looked at 4 different doctors in China and is not quite comfortable yet with the information she's gotten. We were helping her through the process to find consultations in America to give her peace of mind so that she can make a decision following on any treatment in China. We will be following this patient journey carefully to ensure that we provide value in the appropriate way going forward. But what makes this team in America so unique? This is Iron Young, a Chinese Mandarin interpreter in the Bay Area with years of experience working with Stanford Hospital, UCSF, St. Francis Hospital. She's backed up by Dr. David Garfield, an American oncologist with 40 years of experience, formerly of ProMed Shanghai Cancer Clinics, the only Western clinic in Shanghai authorized to perform cancer surgery. There is something else that is going to set us apart from competitors. This in Chinese is 抓病人, which in English means to capture or to seize a patient. We have heard this term used a number of times in our discussions with people interested in the healthcare sector. This word is poison to us. It is poison to anyone looking to provide healthcare services to Chinese patients, because it makes patients feel like that they're a revenue source and just a checkbook. But not to us. To us, they are people who need help. They are sons and daughters, and mothers and fathers, and grandparents in China. And who are we? This is Lucas, our tech guy, who built our product in 4 weeks. I'm the business guy. This is where we're supposed to ask for money. But actually, that's not what we're going to do today. What we're asking for is to find people who have a shared sense of purpose. People who want to help other people get better and healthier. We are looking for people with healthcare experience, expertise, and knowledge. It's only through leveraging our knowledge together are we going to be able to move this mission forward. In fact, we're asking to let us show you our expertise. We are offering free second opinion cancer consultancy services for 10 patients. If there is anyone in this room who has an acquaintance, a friend, or a family member who needs a second opinion cancer consultation, please let us show you our expertise and help these patients. We are Agada, and our mission is to help Chinese people get healthier. Thank you very much.